My community health plan. Did a windshield survey. A familiarization assessment is a common starting place in evaluating a community. I currently reside and work in Toms River, New Jersey. In 2022, Toms River had a population of 92,827 people, with 5% of them being uninsured. And in 2021, it was estimated that there were 122 homeless people in Toms River on any single night. For my windshield study, I assessed Toms River, which is the town that I live in. I focused my assessment near the main hospital, community medical center, and the downtown area. Toms River itself is a very large town. It is 53 square miles. It consists of 18 schools and 1 hospital. There is the Atlantic Ocean nearby and some very large rivers, which makes it a beautiful background. Utilize emergency rooms for their medical care and forego recommended health care screenings and necessary follow-ups. This may be out of fear, lack of trust, or financial insecurity. However, the problem is it's taking away healthcare resources from actual emergencies. It causes increased cost. It also could be that the homeless or uninsured are seeking medical care for emergencies that could have been prevented with regular healthcare screenings and follow-ups. People must have access to dignified medical care regardless of their ability to pay and without fear and without the use of emergency rooms for non-emergencies. For this, we will now be discussing the Medical Clinic and Proud Center for Community Medical Center, which is a great resource for patients to utilize. Clinic is patients with and without insurance. Patients who are seen in the hospital without an existing physician to follow up with. Patients without insurance or citizenship are referred for follow-up care at the clinic. In 2022, Toms River had a population of 92,827 people, with 5.15% of them being uninsured. The clinic specializes in culturally competent care. In 2022, 9.13% of the population in Toms River was born outside of the United States, with most of the population being Hispanic. Heart disease is the #1 cause of death in the United States, as well as in New Jersey, per the Center for Disease Control, with a rate of 18,000 annual deaths per 100,000 citizens. New Jersey is ranked number 12 among the 50 states for amount of annual deaths. Heart disease risk is even higher in the homeless people due to multiple reasons. There is a high prevalence of cigarette smoking, drug use, and alcohol. There also tends to be less optimization of chronic diseases such as hypertension and high cholesterol. In the same building as the clinic, Community Medical Center offers a cardiovascular testing center providing comprehensive testing for patients. There are lifestyle changes that can be made to lower our risks for heart disease. Some examples are quitting smoking if you smoke, maintaining an exercise routine, a healthy diet, limiting alcohol and drugs, getting regular medical testing and follow-ups, and adhering to medications that are prescribed by our physician. Other risk factors such as age, sex, and race cannot be changed. So we have to do what we can do to increase our health in ways where we can. It's also important that we educate our patients on when to seek emergency care. Signs and symptoms of a cardiac event can consist of chest pain, chest pressure, heaviness, jaw pain, pain radiating to the left arm, sweating, also called diaphoresis, fatigue, unexplained fatigue, nausea. For those, you would want to call 911, as well as for extreme cases of shortness of breath. Palpitations, you may need to seek 911. You may need to reach out to your healthcare provider. This is the brochure that we have chosen to help educate our patients. This delivery method was chosen for the ability to have it printed in multiple languages and for ease of handing them out to patients over an extended period of time. This brochure lists different resources and services that we provide at the clinic. This is the brochure that we have chosen to help educate our patients that may be prescribed this delivery method and ways to modify your risk factors. The ability to also have it when to seek emergency care when necessary, and for ease of handing them out to patients over an extended period of time. In this brochure lists different resources and services that we provide women, and people of most racial and ethnic groups. This is the brochure that we have chosen to help educate our patients. In 2022, method was chosen for the ability to have it printed in multiple languages. That is the equivalent of 1 in every 5 deaths. And for ease of handing them out to patients over an extended period of time. $252 billion. This brochure lists different resources and services that we provide at the clinic. This includes the cost of healthcare services, medicines. This is the brochure that we have chosen to help educate our patients. This delivery method was chosen so much for the time the ability that you took to teach us in this class. I had a great time and I learned a lot, and I thank you very much. And for ease of handing them out to patients over an extended period of